The last point we have to pay attention, according to the Center of EBM, is applicability. Are our results applicable or not? For this, we have to ask ourselves, were the patients similar to my patient? So regarding age, sex, occupation, race, so many factors you may consider. Were they similar? Were all clinically important outcomes considered? And are the likely treatment benefits worth the potential harms and costs? Because there might be also some harms, or isn't it? Entering a surgical intervention has some costs, and it has some risks, and also some harms. So we have to look for the study inclusion-exclusion criteria to see whether the patients were similar to it. Then to look at table 1 for the demographic factors and see whether this is general, the conclusions of the study are generalizable or not. If the sample was taken from a group which is similar to yours, to your patient group, then we may speak of a generalizability and discuss whether these results should apply to our patients or not. Regarding side effects and costs, especially side effects, we have a table in this, fortunately, in the sports trial, operative treatments, complications, and events. So I took only a part of the table, a screenshot of the table. What do we see here? For example, blood replacement. They have received, 4 participants have received blood. Is it 4? Okay. It is length of stay, same day, yeah. Blood replacement. 4 participants have received blood transfusions. So this is a risk, of course. And they have stayed in the hospital, most of them 1 night, but some even more or equal or more than 2 nights, so 37 participants. These should be considered together, of course, with the other factors when deciding whether this treatment option is applicable to our patients or not. And all this must, of course, all these decisions must, of course, be made together with our clients, with our patients, in a shared decision-making. Don't forget, shared decision-making is very important in our daily practice. The patient's values, preferences, they must be incorporated into our clinical decision. And of course, there might be some harms or some other factors which were not addressed, which were not included in this research. So we may also consider to look for other investigations. You should not suffice by looking only to one individual paper. Good, that was it. Now I will make a brief summary, but before that, let me stop the recording.